So what if I told you that a single number, a simple medical reading, could get you two totally different diagnoses depending on where in the world you are? It sounds a little crazy, right? But when we're talking about blood pressure, that's pretty much the reality.
All right, let's make this personal. Imagine you're at home, you use a blood pressure cuff, and you see this number pop up, 135/85. What's your gut reaction? Is that high? Should you be worried?
Well, here's where things get wild. The answer, believe it or not, is both yes and no. If you're going by the American guidelines, yep, that's high blood pressure. But if you're using the European guidelines, you're totally fine. So what on earth is going on? How can one number mean two completely different things?
This is really the core of the puzzle we're going to unpack today. That simple question, is it high? Well, the answer depends entirely on which rulebook your doctor is playing by.
You see, it's not just about the number itself. The context is everything. There are two big variables that create this whole situation. First, who is setting the rules? And second, and this is a big one, how and where is your blood pressure actually being measured?
So let's start with the who. The best way to think about it is like a sport with two different major leagues. They're both watching the same game, your health, but they have slightly different rules for what counts as a penalty.
In one corner, you've got Team USA. That's the American College of Cardiology and the American Heart Association. You'll see them called the ACC/AHA. And in the other corner, we have Team Europe, which is the European Society of Cardiology, or the ESC. Now, both of these are incredibly respected groups, but they've just landed on different conclusions about where to draw that line in the sand for high blood pressure.
But okay, it's not just who's making the rules, it's also about how the game is played. It turns out where you take your blood pressure can completely change the reading. Let's break down the three main ways this is done.
First, you've got the one we all know, the clinic reading. You're at the doctor's office, they wrap the cuff around your arm, classic stuff. The thing is, it can be a bit unreliable. Ever heard of white coat syndrome? It's that feeling of stress from just being in a medical setting, and it can literally push your numbers up temporarily. So, to get away from that clinic stress, we have what's called SMBP, or self-measured blood pressure. This is exactly what it sounds like, you taking the readings yourself at home, probably on your own couch. This gives a much, much better picture of what your blood pressure is like in your normal, everyday life.
And then you have the gold standard, ABPM. That stands for ambulatory blood pressure monitoring. This is a whole other level. You wear a device for a full 24 hours, and it automatically takes your blood pressure day and night, even while you sleep. This gives you the most complete, detailed movie of your blood pressure, not just a single snapshot.
Okay, so we've got the two different rule books, and we have the three different ways of measuring. Now, let's put it all together and actually look at the numbers. This is where you can really see the difference. Just look at this table. On the American side, the ACC/AHA keeps it simple. 130/80 or higher is considered high blood pressure, whether it's measured in the clinic or at home. But then look at the European guidelines. They give you a little more wiggle room. In the clinic, the line is 140/90. At home, it's 135/85. And that brings us right back to our original number. That 135/85 you took at home, according to the European rules, you're fine. That's normal. But in the United States, that same number gets you a diagnosis of stage 1 hypertension? It's wild, right? The exact same reading, two completely different medical labels. This number right here, 130/80, this is the real game changer for the American guidelines. When this lower threshold was introduced, it was a really big deal. It meant that millions more people in the US were suddenly classified as having high blood pressure, while their friends in Europe with the exact same readings were not. And this difference stays true even when you look at that 24-hour gold standard test. You don't have to memorize all these numbers, just notice the pattern. Whether you look at the average during the day, at night, or over the full 24 hours, the American thresholds are consistently lower than the European ones. Okay, I know, that was a lot of numbers and acronyms, and it might feel a bit confusing. But the whole point of this isn't to create confusion, it's actually to empower you. So, what does all this actually mean for you when you go to the doctor? So here's what you can do. 3 simple things. First, know the context. Don't be shy. Ask your doctor, hey, which guidelines are you using? And talk about how the measurement was taken. Second, please remember that one reading is just a snapshot. It's a single moment. Tracking your numbers over time, especially at home, tells a much richer story. And third, use all this info to really partner with your doctor. This is about having a smarter conversation so you can understand what your numbers mean for your own unique health.
And all of this leaves us with a much bigger, kind of philosophical question. When one single number can mean you're healthy on one continent and you have a medical condition on another, what does that really say about diagnosis? Maybe, just maybe, as we track more and more data about ourselves, the future is less about hitting a single universal target number, and more about understanding the complex, personal story our bodies are trying to tell us.